Welcome back to San Antonio Living. Has there ever been a time when your knee hurts or your hip hurts and you're like, but what is causing it? And when is it time to see the doctor? Well, with us today is Dr. Naugher. He is with SA Orthopedic Group. Hello, Dr. Naugher.
Hi, good morning.
Good morning to you. So let's talk about hip and knee pain. You know, it's actually a common thing, but what could cause that sort of pain?
So it is very common for people to come into my office and the office of my colleagues with hip and knee pain. I like to break it down into acute versus chronic. Acute meaning you've fallen, you twisted your knee playing basketball, you took a wrong step off of the stairs.
Like something specific caused
Something happened, yeah, you've got new pain. Chronic is the pain that comes on over time. It's a dull ache, it's getting worse, it's irritating, it's starting to affect the things you like to do. So it's either acute or chronic. The things that can cause that are different structures inside the knee. Now, for people that are older, more experienced, older in years, they typically come in with arthritis and wear the joint. I'm going to grab a little prop here. And what that actually is on the ends of the knee joint itself, this is the end of the thigh bone, you have smooth cartilage, and that wears away, and that's arthritis.
So this is the knee.
This is the knee. Bones. So if we're looking straight at it, this is the bones and the ligaments. If we move the kneecap out of the way and actually look at the joint, this is where arthritis occurs. It's roughness on the ends of the bone where cartilage, which should be smooth, is no longer smooth.
Right, and that's going to cause pain.
Yeah, and that's arthritis. But getting into more the younger crowds, the younger kids, or even people that are active, kind of want to talk about the other things that could be injured, and it's not just the bones. It can actually be meniscus, ligaments, and the cartilage or the smooth bone itself. And just to show you again, inside the knee joint, the actual meniscus, which is soft tissue, it's like a shock absorber inside the knee. That can be injured. The ligaments, the ACL, PCL, you've heard about those in athletes. But also all these ligaments on the outside can also be injured.
That's all fascinating. Whether you are experiencing arthritis, whether you're in sports and younger, either way, if you're having knee pain, you got to get it checked out. You
do. Now there's different scales or on the spectrum of pain, what needs to be checked out, what doesn't. I typically think pain that starts and it's giving you some irritation, but it's not affecting the way you walk. If you're not limping, if you're still able to get around, give it a few weeks. Do the things like RICE, we say rest, ice, compression, elevation, things like that. If you can get through with some of that, you may not have to have it checked out. But pain that's causing swelling, or if you're limping or you can't put weight on it, whether it's in the knee or the hip, you really should have that checked out by someone.
Absolutely. Let's talk about when your patients come in and say, it just hurts, it will not go away. What kind of treatment plans do you have?
So it really depends on what's causing it. So we'll want to see somebody in the office and examine them and listen to them, tell us about their pain, and then based on that we kind of direct treatment plans. It can be anything from as simple as anti-inflammatories and rest from the activities that make you hurt, to things more aggressive like physical therapy or injections, or more what I do, which is surgery, and arthroscopic surgery in particular. That's procedures both in the knee joint and the hip where we make small incisions, generally about the size of my pinky, and we can address injuries to these different structures through small incisions.
All right. Well, wonderful information. Thank you so much for talking with us today, Dr. Naugher. And of course, if you are having any sort of knee pain or hip pain, it's time to get it checked out at the SA Orthopedic Group. You can give them a call at 804-5400. They also have a website, TSAOG.com, and they are on Facebook, the San Antonio Orthopedic Group, and Twitter at the SA Ortho Group. All right, guys, coming